Congressman, good to have you here. Appreciate the visit.
Thank you.
Let's talk about health care. It seems like it's obviously very important, but very complicated, and it's hard to sort out sort of like the real news from the fake news, and are people going to lose their coverage? Are people with pre-existing conditions going to be covered? Sort through a lot of that for us.
Let's start with pre-existing condition. The same provision that's in the law today that prohibits an insurer from denying you coverage because you have a pre-existing condition will be in the law under our bill. That has not changed at all. So it doesn't matter what your condition is, insurers have to give you insurance. Now, under the present law, they cannot take into account your condition when deciding what the amount of your premium is going to be. That also would be true in our law, except a state, Alabama, could go to the federal government and say, we can get our premiums down for people with high-risk conditions by putting them in a state high-risk pool. So we would like to have the option of doing that.
But sometimes the high-risk pool can really just jump up premiums, though, correct?
The experience in Maine and Wisconsin was the opposite. In fact, in Wisconsin, people with pre-existing conditions had lower premiums on that state high-risk plan before the Affordable Care Act than they have today under the Affordable Care Act. So they would have been better. People in Wisconsin with pre-existing conditions would have been better staying with their state high-risk pool. Now, it's not going to be easy for states to set up these pools. So I predict a lot of states aren't going to do it because it's difficult, it's going to be expensive, the state's going to have to put a lot of money into it. So it's not something a lot of states are going to take advantage of. But if a state can give the people with pre-existing conditions in their state a break on their premiums, why wouldn't we give them that option to do that?
Well, Alabama's always saying we don't have money to do this, we don't have money to do that.
Not likely that Alabama would take advantage of this. And if that's the case, then everybody in Alabama would be subject to the same provisions as we've got today in the Affordable Care Act with regard to pre-existing conditions. Wouldn't change.
Wouldn't change at all?
At all.
What about people who now have insurance under the Affordable Care Act? Would they be able to also have insurance?
They would be the insurer would be required to provide them insurance. Instead of getting the subsidies they get right now, they would get a tax credit. But it's called a refundable tax credit. It's based upon your age, because the older you are, the more you pay for it. And that refundable tax credit, to the extent you don't need a credit against your tax liability, you get a check from the government. So it's another way of giving people subsidies, but it's a way of evening the playing field between people, the vast majority of us that get our insurance from our employers, and the 7% of the people in America who buy their own insurance individually. All of these provisions we've been talking about, pre-existing condition, all that, it only applies to people under the present law that buy their own insurance individually. It only applies to 7% of Americans.
Mm-hmm. What about people who currently get their insurance through their employer? Would the Republican plan that went through the House impact that at all?
Not at all, except we think that by bringing overall health care costs down, it should bring premiums down for people in the employer-provided market. But there's no provision in our bill that has any direct impact on those plans.
What kind of changes do you think the Senate might make to the plan? Because now it's in their hands.
Well, you're hearing a couple of different things, and they're kind of contradictory. One is that they'd like to say, no, we don't want to give states any options. And the other is, no, we got to give states more options to get premiums down further. They're going to go through the same struggle in the Senate that we did in the House between moderates and far conservative people to try to figure out how they can get enough votes to get to 50, because there are only 52 Republicans. No Democrats are going to vote for this. They've all said none of us are going to touch that. We have to get 50 because Vice President Pence can give them the one. So they're going to lose 2 senators over there. And putting this together on the Senate side is going to be at least as difficult as we saw it on the House side.
Let's talk about red snapper.
Yeah.
This is something you've talked about for years and years, saying that the federal government really hasn't figured out how many red snapper there are in the Gulf. They average what's on the East Coast and down here, and as a result, we get penalized.
Right.
Do you see any relief for the recreational fishermen who say there's plenty of red snapper out there?
Well, first of all, there are plenty of red snapper out there. And the reason we've got this crazy decision is that the federal scientists won't sample on reefs, which is where these fish live. Yeah, right. It makes no sense. One of the appointments that President Trump will make is the person that will head a federal agency called the National Marine Fisheries Service. That's who makes this decision. So getting the right person to that position under President Trump is, I think, the first and most important thing we can do. And believe me, we're working fast and furious on that. But secondly, remember, I had my piece of legislation. We've reintroduced it. Actually, it was reintroduced for me by the committee, the Natural Resources Committee, put it into the Magnuson-Stevens bill, and so it's right there. And we passed it last year through the House. Couldn't get it to even be brought up in the Senate. So we got to keep pushing on that, get it through the House. We got to figure out some way to get the Senate to bring it up.
Now, what about going even higher than the head of the National Marine Fisheries, the cabinet level position? Who runs that?
Yeah, that person reports to the head of something called NOAA, National Oceanic and Atmospheric Administration, and that person reports to the Secretary of Commerce. This does have a direct impact on commerce. Ask anybody in Orange Beach. So if we have to, and I'm certainly not going to be shy about this at all, I will go to the Secretary of Commerce. I'll go to the President. I think this is that important. This is affecting basic freedoms for people in the Gulf of Mexico to fish, and it's affecting a huge part of our economy. And if we got to go to the President to get this done, then we need to go to the President and get this done.
So just 3 days of recreational fishing this year?
That's just a long weekend. And what if it's storming? Plus you'll have everybody going out at the same time. It's madness. And there are plenty of fish out there. We know, our scientists, the scientists on the northern Gulf Coast, they know as a matter of science that there are plenty of fish out there. We've just had bad science from those people down in Miami with the National Marine Fisheries Service.
Congressman, thank you very much.
Thank you.